Hello everybody, and welcome to the Thursday edition of Video Clips. Many people, mostly young people, often claim that they don't want to live to an old age. And it's actually not surprising when you think about a couple of things. First of all, the health status of even younger people is worsening. Two of the fastest growing businesses in the United States are nursing homes and memory care facilities. Certainly growing old in the United States doesn't seem like something to look forward to, and it's like this in a lot of other westernized countries as well. But an interesting thing, my experience has shown that when people develop life-threatening diseases in their 60s, 70s, even their 80s or 90s, they almost universally would like to live longer. When actually faced with mortality, an interesting thing happens. People tend to realize that life on Earth is pretty good and they want to stick around as long as possible. So if you really, in spite of what you might say publicly, want to grow old and remain healthy instead of dying prematurely, what is the secret to health and longevity? Well, Americans have been told that life expectancy has increased during the last 100 years, largely due to improvements in healthcare. It really hasn't. It's the statistical sleight of hand that's made it appear that we're living longer. Reductions in infant mortality, actually a good thing, have made it appear that we're enjoying longer lives, but the estimates of actual life extension range from 3 extra months to 3 extra years during the last 100 years. So if people stop dying as infants when they're a few hours or a few days old, that automatically statistically skews what looks like average lifespan, and that's what these are the data that are being used to convince people that things are actually getting better. Americans have also been led to believe that better access to healthcare leads to better health and longer lives. This is often used as a justification for the ridiculous increasing cost of healthcare, with the idea that any return on investment that the return on investment is certainly worth any price that we have to pay to lengthen lives and extend lives and improve quality of life. As a result, most public policy discussions concerning healthcare focus on making the current healthcare system available to people who don't currently have access at almost any expense necessary to deliver it. We're regularly told by people who promote this idea that this will result in better health outcomes for all. The reality, though, is that lack of access to medical care accounts for about 10% of premature deaths, and the other 90% due to something entirely different. According to a new review, behavioral and social determinants are more important than healthcare and access to care in determining life expectancy in the United States. The researchers analyzed 4 different data sets using 4 different methods. One group determined that the most significant contributor to premature death was cigarette smoking, accounting for about 400,000 premature deaths in the U.S. every year. The same group determined that 300,000 premature deaths were due to dietary habits and lack of physical activity, and another 100,000 deaths to alcohol abuse. Other factors that contributed to early death included firearms, risky sexual behavior, motor vehicle crashes, and the use of illegal drugs. Another data set included research on Medicare patients in 206 hospital service areas in the U.S. and looked at medical diagnoses, poverty, and factors such as obesity and smoking. Communities receiving more medical care did not have longer life expectancy after controlling for medical diagnoses and spending on health care. The biggest predictors of premature mortality were obesity, cigarette smoking, and self-reported health issues. And where do the self-reported health issues originate? Diet and lifestyle habits, which also are largely responsible for obesity. The RAND health insurance experiment randomly assigned families to insurance plans that had varied copays, which ranged from 0 copay to an annual deductible of $1,000, which was particularly high at the time that this particular study was done in the 1970s. Variations in cost sharing impacted utilization. Those in the high deductible group had about 40% fewer office visits to doctors, were 23% less likely to be admitted to the hospital, and overall spent 31% less on health care than those who had what appeared to be free care, as in no copays or deductibles. But there was no discernible difference in health outcomes, with the exception of certain vulnerable populations, such as people with severe hypertension, who did fare better as a result of more medical intervention. Overall, however, more care did not result in better health status or a longer life. Now, why does this matter? Why am I talking about this right now? It's an election year, and healthcare is a big part of the discussion among candidates. Many of them are competing with one another to offer more access to healthcare services to more people at sometimes no cost whatsoever. Some have stated that healthcare is a right and should be offered free by the government. Almost all of the proposed plans cost enormous amounts of money, and what they have in common is that they're based on two quite incorrect assumptions, and the studies that I've just cited are just part of the data that are available to support what I'm saying. One misunderstanding and myth is that health outcomes are better when people have more access to care. And the other is that the more we spend, the better things are. Neither are true, which means we're having the wrong discussion. We're talking about how to make things that don't work available to more people and arguing how to pay for expanded bad care. I've been talking about this for years. Do I think we need to expand access to health care? We probably do, but not the type of health care that we're paying top dollar for that doesn't work. So the real discussion should be about how to reform healthcare in meaningful ways, and I have 5 or 6 here that I'd like to talk to you about. One is medical education. Changes that include an emphasis on diet and lifestyle change, identification and treatment of the cause of disease, learning research skills, definitely classes in ethics, and encouraging medical students to speak out and challenge the status quo. We need more people who are independent thinkers in healthcare settings. And I listened to a podcast in which a doctor was talking about the difference between law school and medical school. And law school students are expected to argue and dissent and to talk about how they would try a case differently and to argue with their professors. Medical school is about compliance. We're turning out compliant people, not good. So we need to reform medical education. Second thing, federal agencies. The law allowing drug companies to pay the FDA to have their products reviewed should be repealed. The NIH should not be receiving royalties on products like the HPV vaccine, and clinical trials should be conducted by groups not paid by the drug companies. Raw data should be posted on public websites and provided to the FDA instead of the current method, which involves drug companies submitting what they choose to submit to the FDA. Government regulators have become business partners of drug companies, and they need to be restored to their regulatory function. Third thing, insurance. Everybody loves to beat up insurance companies. But insurance companies have been forced to pay for ineffective care, which often leads to more claims for the side effects of the bad care that they paid for in the first place. Just by way of I'll just give you one example. Avastin was approved several years ago for the treatment of breast cancer. It costs $100,000, roughly, give or take. It doesn't extend life by a single day. When you're asking Medicare, whether the government's paying for it or a private insurance company is paying for it, if you're asked to pay $100,000 for a drug that has serious side effects that doesn't extend life for a single day, there's no hope of controlling costs, right? So I suggest that we establish some evidence standards for reviewing protocols, and it's on the basis of those standards that things are reimbursed. We could use ours, for example. I mean, in every other area of our lives in which we purchase insurance, companies are not expected to write blank checks for anything that the car repair shop or whoever wants to charge. I mean, I've had my car repaired after accidents a couple of times. I've had insurance claims for houses I've lived in. In every single instance, I had to get estimates, and somebody was overseeing the expense. I mean, if you have storm damage and part of your roof needs to be replaced, insurance companies aren't going to write a $30,000 check to replace 1/10 of your roof. It just doesn't happen that way. So costs are going to escalate as long as we're asking third-party payers to pay for bad care and then to pay for the consequences of the bad care. The next thing, reform licensure laws. The United States is the only country in the world in which what we refer to as traditional medicine has crowded out all other forms of healthcare and related practitioners. Monopolies are never a good idea, and the medical profession has been able to operate one, and the dietetics profession and the nursing profession for a very long time at the expense of public health. And if you look at other more successful systems, one of the things they have in common is the ability for consumers to source both what we would refer to as traditional care and alternative care at the same time. Speaking of monopolies, abandon the idea of government-run medical care. It doesn't work in other countries. For example, the government in the UK is encouraging people to buy private insurance because the NHS, the National Health Service, is bankrupt, and it has been for a long time. Now just think about the government-operated programs in the United States. The Veterans Administration is a good example. Just a few years ago, veterans were dying before they got care at clinics, and guess how it got solved? It's not by more government, it's by allowing veterans to access private care, is one of the things that was key in solving the problem. Then look at Medicare. In spite of the fact that seniors have to purchase supplemental policies if they want better care because Medicare can't cover all of the costs, the system is still scheduled to go bankrupt in just a few years. We do not need more of this. It's simply not a good idea. Last but not least, we should pass a law requiring that medical consumers be properly informed with criminal penalties if this is not done. We have these types of laws in place for mortgage lenders and financial advisors. We need to have laws to cover healthcare with violators subject to criminal prosecution. Empowering people to make decisions about healthcare is only a good idea if the choices are based on a complete disclosure of risks, benefits, and alternatives. If we don't implement these types of reforms, healthcare is going to continue to get worse. The quality of life, quality of health, mortality rates are going to continue to get worse while we pay more and more and more money. Nothing will get better as long as we maintain this status quo. So when you hear people talking about all the free stuff they're going to give to all the people who aren't currently getting it, I'm willing to take the step of saying that healthcare needs to be available to more people, but not what we're doing right now. Expanding what we're doing right now would be disastrous. And it would be disastrous for many of the people receiving the bad care. It's disastrous economically, and it avoids the really tough discussions that we ought to be having about the issues that I've brought up here. All right, that's all for today and all for the week. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.